a quorum, so. Good afternoon, everyone. Health and Human Service Committee will come to order, please. Madam Clerk.
Commissioner Baker McCormick,
Here.
Commissioner Marecki,
Here.
Commissioner Anderson,
Here.
Commissioner Killeen.
Yep.
Chair Scott,
Present.
you have a quorum present.
Thank you. Next item, please.
B, Chairwoman's remarks.
I have none at this time. Next item, please.
C, approval of the June 10th, 2025 meeting minutes. We have a motion by Commissioner Anderson and a support by Commissioner Baker McCormick.
That's right. Slow on the button.
Right. Thank you. All in favor? Okay.
Please vote using a tab.
No. Yeah, that's right, honey. You need to help me with this.
Motion carried.
All right, thank you. Next item, please.
D, unfinished business. There is none listed.
Thank you. Next item.
Moving to item 1 under new business, requesting commission approval of the appointment of Portia Carlisle to the position of the Division Director of Community-Based Services, Department of Juvenile and Youth Services.
All right. Good afternoon.
Good afternoon, Madam Chair. Melissa Fernandez, Director of Juvenile and Youth Services. I am pleased to request the appointment of Portia Carlisle to the Division Director position of Community Programming with the Department of Juvenile and Youth Services. This position was created 2.5 years ago with the new department, and it was never filled. So it was a position that I carried for some time. As the department continues to grow and we have an increased projects, programming, collaboration with community-based organizations, grants, and collaboration with community projects, including the oversight of our CMO system, Portia will take over all of those duties. Portia is from Westland. She is a resident of Wayne County, and she has served as the department manager GAA position within Juvenile and Youth Services for the past year. She provided oversight for all of our contracts in the department and really has been instrumental in monitoring our audits, our invoices, the effectiveness of services provided to youth and families. Portia has a rich and robust background. She worked at GrowthWorks for many years as a case manager and also as a supervisor. She's also had many positions in behavioral health, foster care, and juvenile justice over the tenure of her career.
All right. Thank you. Would you like to say anything, Portia?
I just look forward to the opportunity to continue the growth within the county. We are looking to expand a lot of our programming for our community-based services with our youth, knowing that that's essential to keep them on the right track. My experience being on the groundwork has really motivated me to stay within the realm of juvenile justice. So I'm looking forward to the opportunity.
Very good. Thank you so much. Does anyone have any questions of Portia? Go ahead, Commissioner Anderson.
Thank you, Madam Chair. Since this young lady lives in my district, I wanted to be the one to make the motion to approve her appointment to that position.
Thank you.
Thank you.
Commissioner McCormick.
And I'd like to second that since she lives in Wayne County. I love that. Thank you.
Very good. Commissioner Killeen.
Thank you, Madam Chair. And yeah, it's been a little while since we talked about the community-based services. So that's kind of been non-functional since the
services have been going on and functional. The oversight has been.
So can you say a little bit more about what comes under that umbrella?
So all of our contracts with our CMOs, our care management organizations, our entire probation, our community contracts such as the Bryan Grant, any grants that we have as well, our collaboration with Wayne State. We have quite a few projects happening with them right now and any other community programs that we're getting ready to kick off in collaboration with DHS and other community partners.
Okay, so this will allow us to kind of consolidate and, for lack of a better term, rationalize.
I think it'll allow us to have streamlined oversight of all of those things where really I have been working with Tia on managing all of those that entire division. That entire division hasn't had a division director, so we've been tackling the oversight of that.
All right. Thank you. Thank you, Madam Chair.
Great, thank you. Commissioner McCormick?
Thank you. Just one other thing, because you mentioned the oversight, and I think that is vitally important as we, look at the roles of the CMOs moving forward. And I know you were talking about making some major changes. Do you know when we will hear more about that?
Sure. So the contract, the CMO contract will be in front of you shortly for an extension. So there isn't a year extension on that contract as we continue to figure out what it's going to look like moving forward.
All right, thank you. Commissioner Marecki?
Thank you, Madam Chair. So that's a September to September contract?
I believe it's October,
Okay.
October to October.
Okay, thank you.
Okay. All right, thank you so much, and I'm sure we're gonna bring you in here in just a few minutes. Thank you. Thank you.
We have a motion by Commissioner Anderson and a support by Commissioner Baker McCormick.
All in favor?
Please vote using your tablets.
Thank you, darling. I probably need to put that over here for you.
Motion
Thank you
carried.
so much. All right. Welcome aboard. Next item, please.
Item 2, requesting commission approval of a local health department staff well-being grant agreement with the Michigan Association for Local Public Health to fund supportive services for the Department of Health, Human and Veteran Services staff.
Thank you. Thank you so much.
Hello. Yeah, so we're excited about this. This is a unique opportunity. We were approached to apply for this grant. As you
Your
all,
name, please?
oh, sorry. Aja Harris Martin, Chief Program Officer, HHVS. I apologize. But we were approached to apply for this grant to support our current health staff. As you all know, health workers are often burnt out, recovering from the COVID pandemic and now facing other challenges as it pertains to kind of federal changes. So this grant will just help us increase the work that we're already trying to do with building team morale and culture within HHVS.
Okay. Any questions? Commissioner Marecki?
Thank you, Madam Chair. So who's going to coordinate all these fun activities?
Yeah, so we have a department administrative team. The health director has a executive administrator as well. We have a chief of staff. So with her in conjunction, they're the ones that are centrally coordinating those activities.
Okay, and it's $5,000. Okay, thank you.
Okay. Anyone else? Okay, so we have a motion by Commissioner McCormick, second by Commissioner Anderson. All in favor? In vote?
Motion carried.
All right. Thank you. Yeah. Thank you, Darrell. Commissioner Anderson?
I just wanted to ask for clarification. You said your last name is Martin.
Harris Martin.
Yeah, I just gotta commend you. Every time she comes to one of our committee meetings, and even at the end of the day, she's always smiling, got this bright face. And my mother's maiden name was Martin, so I guess
All right.
take good luck to you
Thank you.
again.
Yes, thank you so much.
Continue doing the good work for us.
I'll stay up here. I'm the next item too.
Pardon?
I said I'm the next item too.
Oh, okay. All right. Okay. Next item.
Item 3, requesting commission approval of a 24-month professional services contract with a 1-year option to renew with Eastern Market Corporation to design, implement, and manage fresh trucks to deploy mobile grocery stores to serve 43 communities within Wayne County, promoting healthy eating and improving overall well-being for residents.
So Aja Harris Martin again, for Chief Program Officer of HHVS, and then I have
Hi, Ryan Dinkgrave with Eastern Market Corporation.
I'm sorry, Ryan, what was your last name?
Dinkgrave.
Singrave.
Dinkgrave.
Singrave, all right.
There's not many of us.
Okay, all right. Okay, thank you. All right,
Yeah, so we are excited about this partnership. This is one of the Will Wayne programs that has been introduced to you all before. So we had to put this out for bid. We got 2 bidders. Eastern Market was awarded that bid after following the procurement process. And they've been a great partner with us, trying to figure out the logistics of how this will run and operate. So also appreciate commission staff's efforts since this is a new, innovative, something that our ordinances are not used to. So we are excited to roll this out so that we can get launched this summer. We will likely have to use somebody's phone. What's that? No? Okay. Somebody's phone.
Melissa
Oh, okay. I was like, oh, something's happening here. Okay. So we will likely partner with them to use their existing farm stand program because it will take some time for our mobile grocery truck to come in. But we are partnering with them to create a mobile grocery store unit that will go out to all of the communities and then focusing, as the contract kind of states, on a lot of the locations that have been signified as food deserts or have inaccessible access to food. So we're really excited to partner with Eastern Market. I'll let Ryan say a few things as well.
Yeah, thank you very much. We're really excited about this project. Our farm stand program has been around for more than a decade and has been serving largely Detroit locations, but a few others outside of the city. But now we're really excited to move it to the whole county. We know that food insecurity is real in every community, and with the new truck that we'll have, we're going to be able to hit more places more often and serve more people. It's actually going to be a really cool vehicle that just pops up, door side opens up, and we'll be able to sell right from there. So people will be able to use all of their different payment methods and benefits. So it should be very accessible, and we're looking forward to mapping out the truck routes and spots where we're going to be for the next 2 years.
Okay, and I'll be excited too to make sure you put Highland Park up there.
I would never
Okay.
miss Highland Park. I love Highland Park.
I remember it was kind of low on the totem pole now.
Not to me.
Okay,
I
all
will
right.
personally guarantee you
All right.
get to Highland Park.
Thank you. We need it more than probably any other city. I have to let you all know that. Okay, thank you. All right, Commissioner McCormick.
Thank you, Madam Chair. So I'm really excited about this program because it's, to me, proactive instead of always being reactive. And we do definitely have food deserts in Wayne County. And in fact, the Youth Council just sponsored a resolution that talks to food deserts. And so these are young people, 10th through the 12th grade, that would be excited. And I think they even included this program in their resolution that talked about how we can rectify this issue. So I'm excited. The thing I guess I'm looking at here in the contract, just making sure that we spend the dollars as appropriately as possible so we can get the best bang. I'm just wondering about this printing services, 379,000. I'm just wondering, did we look at, is that being used I'm just, explain it, please. I'm just like.
That's actually for 2 of the trucks. The
okay.
printing amount is much smaller. It's only $49,000.
Okay, but
Yep.
this is for the outside, right, of the truck, right?
For the printing, no,
Printing.
that's for print materials, price sheets, offerings. The truck is that 379 is all inclusive for the truck with it wrapped and everything.
Okay.
And 2 trucks.
Okay, I misunderstood because it looked like for printing services,
Yes.
it was, but it's actually, okay, for the outside and
The purchase of it,
purchasing,
yep.
Yep.
purchasing the truck and all of the advertisements
Yep.
and, okay. And then we have the 49,000 for promotional materials, what does that look like? Is that a website? Is that in each community? Do you have a plan for?
Yeah, so
What
this
that
is,
looks like?
this is something Eastern Market will continue to pair and work with. Ryan can tell you, they used current existing estimates of what they use for the farm stand program, and then we kind of estimated and talked what we would like to include in our suite. The other thing that the van will include is recipe cards and nutritional facts. So that's a high cost of printing as we distribute that to the community. So the van has multiple services, not just grocery, but also focusing on nutrition services as well. So that'll probably be where a bulk of those printing costs come. But Ryan, you want to?
Okay.
Yeah, that's correct.
So the food that you're selling on the truck, you're saying there's cards for recipes that go with the individual items. Okay, great.
They're one of the more popular items at if you come to the Saturday market, people take those a lot. They're
Great.
pretty cool.
Thank you.
Thank you.
Commissioner Marecki?
Thank you, Madam Chair. Thank you. So who's doing the recipe cards? Do you have a dietitian doing that?
We actually have had, I don't remember how many, we have a couple dozen that we've designed and used for a while. I don't remember who actually originally did them, but they are intended to be nutritious foods. So they're pretty,
As a registered dietitian, retired, I was wondering who did the recipe card.
they're not, ribs and.
Well, that can be
Yeah.
all right once in a while. So you mentioned that Eastern Market's been doing this for 10 years. Do you use a truck? Is
Current-
this something new with the truck? Because we're buying the truck and you guys are upkeeping the truck,
Yeah.
correct? Okay, so go ahead.
Yeah, so currently they take vans or a Transit Connect vehicle out, and the people that are operating, we call them our fellows. They have to set everything up, tables, tents, chairs, put all the stuff out, set it up. So there's a lot of setup and breakdown time. So this will allow us to go to more sites because we can just show up, have a schedule, say we're going to be here for 2 hours, and just show up and serve people right away and then go off to the next site. So it'll really increase our capacity.
Sure. And save some time. And so there's a 20% markup on the produce to help with the expenses for everybody. And you're gonna figure out what areas you're going to be in, and Commissioner Baker McCormick's question, you're going to advertise in advance that people will be able to plan their time. And it'd be really good for the commissioners to have some kind of list so that we can promote it in our communities.
And we could do that as well. I know in the health department, since we have a lot of services that we're continuing to outreach, our community engagement team, they have now a sheet where you can request. And so once we get up and running, this would be something that people can request. It does not mean we have to fulfill every request. It will be us, communicating with Eastern Market to see if they can satisfy, we have a request to attend this church health fair in Inkster on X date. And then it'll say like, yes, we can do that, or no, we have this other. So as a health department, we have a request form. So anyone in the community, we have to begin publicizing it a little bit more, but anyone can say, I want the vision and hearing mobile van to come. Can they do that? Or we want maternal health, services to come and do a table. So those are things, and this will be another thing that the community can.
Yeah, and we all do newsletters. We have the ability to really target emails, and we can be very helpful with this. So
With the new website, we are trying to use the calendar feature. So that's what we're trying to learn that at the same time.
okay, all right, great. Let's see. Okay, and there was a talk about 2-year life expectancy of the trucks, but that was the program, not the trucks. That was.
They should last a lot longer.
So Madam Chair, if I could, and if council, they did an extensive work on this subject, and I'm wondering if there's anything else that council would like to put in, or any concerns. There was a lot of questions back and forth by our staff. So I just wanted your input.
Good afternoon to this honorable body, Mary Parisian, Assistant Commission Counsel. Just as you had said, extensive amount of collaboration amongst the two parties. And I don't think we have anything further. I think all of our issues have been addressed and are in the analysis as well. So if you have any further questions, don't hesitate to ask.
Okay, Well, I appreciate that, and I appreciate all the work that was put into this, this project, and I think that's it then. Thank you.
Okay, thank you. Do we have a start date?
We have to discuss that, but we won't have the vehicle for some time because it has to get outfitted, et cetera. But we're gonna work with Eastern Market to see if we can not repurpose, but expand, and use their current existing, what he just mentioned, break down, build a, the transit van. If we can expand that so hopefully sometime this summer, we'll start. If y'all have events that you would like us to, but we haven't had those discussions because we haven't started the implementation piece.
Okay.
But if you have things, we can talk to Eastern Market about including that.
So is it one truck or two trucks? I thought I heard two.
It'll be
earlier.
two
Yeah.
over the course of the contract. And, but the program our farm stand program is operating today in multiple places. So we would be able to start deploying to more, locations pretty soon.
Okay, thank you. Anyone else? Commissioner Kleen?
Thank you, Madam Chair.
Follow up with that.
And we'll remember when these trucks used to go up and down our streets weekly. And the importance of getting a fruit vendor's license if you were running a political campaign in Detroit. Because that allowed you to use the speakers
Yeah,
on the street. Yeah, it was a big deal.
yeah.
Yeah, I'm also a board member over at Authority Health, and we're about to launch a food truck of our own. And we do have, what do we call it? Healthy and resilient communities. These Eastern Market people have signed up with us on that, where we put little small coolers. I think we have 200 locations now around where people can just grab healthy wraps and salads and that. So with that and with limited money, and I don't know all of the details of all of the grants, but I'm thinking collaboration and discussing, where's your truck going to be? What do you have? Because we also have locations where we have these small coolers and gas stations and various things. So first of all, are you aware of that? And second of all, can we collaborate?
Yeah, I was not. And y'all know CEO's kind of mantra this year is collaboration is the new currency. So we are definitely open to collaborating. So I know where to find you. You know where to find me.
Yeah, because there's never enough money for this kind of thing, right? So if we have two public entities that are both doing this in Detroit and Wayne County, so there you go. Hopefully you can have good conversations. It gets more food to more people.
Yes, we can definitely include that in our implementation plan and reaching out to our friends at Authority.
Authority Health. Yeah, thank you. Thank you, Madam
All
Chair.
right, thank you. Commissioner Anderson, please.
Thank you.
Mhm.
Thank you, Madam Chair. Okay, now I am. All right. I couldn't hear it myself. But anyway, I just wanted to say hello to Ryan. We've known each other a long time. I think we were doing something with Southwest Detroit, weren't you, for quite a while?
And Focus Hope before that.
See, he's got a background in a lot of this stuff, and I was glad to see your name involved with this. And but anyway, I'm very supportive of it. I'd like to see us also reach out to some of the senior populations that may be already on your list. I'm thinking of Senior Village or Silver Village in Livonia. There would probably be a lot of seniors if they knew the schedule that would come out and would, because I assume they're going to be able to get the fruit and vegetables at a lower cost than they would at the grocery store. And plus, they don't have to make the trip to the grocery store. Some of them are probably transportation challenged. It's just, I think it's a great thing. And like my colleague here, it reminds me, when I was lived on a little rural area in Tennessee, that the trucks would come around with fruit and potatoes and things like that. And it was always when I was visiting my grandmother to go out with her and go through the food truck and but anyway, I appreciate you doing this, and I think it's going to be something that'll be hopefully very beneficial to a lot of people that don't get the fresh food and like the saying about the desert, you know, but I think we are on the right track. Thank you.
Thank you, Commissioner Anderson. Commissioner McCormick?
Thank you, Madam Chair. So we continue to talk about the schedule, and we have 2 trucks. And you also said that some of the trucks, or one of the trucks or both, can go to designated events. But will there be a consistent schedule where they will be all the time? Like on this day at this time, it'll be here, rather than you just call us and we're over here and we're over there.
Yeah, no,
So-
we can definitely do something like that. We haven't planned out the
Okay.
implementation by any
'Cause that,
means.
yeah.
But no, that's a good point so that people can know where to expect.
Exactly.
Mhm.
So I
Absolutely.
just wanted to, say that consistency is good.
Mhm.
And I think that's important as well. Thank you.
And we can put that in our newsletter so
Great.
that they will
Yep.
know. Okay.
Rotate.
Thank Commissioner Marecki.
Thank you. I have one more question, because I was reading about kind of the truck history here. You're gonna get something from Canada and because of different things that are going on. So do you actually have bids out for trucks right now in the US?
Yep, correct. With the vendor that's listed in here, which is in New York.
Okay, and it's already been approved, the truck, or,
We haven't executed a contract without
Right.
having this.
but I mean, you already are in the process of using
Yep.
that type thing. So when do you think that, after this is approved, when do you think you'll get the truck?
What was the lead time?
Okay, all right. Yeah, and you'll do this year round?
That's the plan.
Yeah.
Okay, all right.
I'm sorry, I didn't hear
Yeah,
that.
we,
Well, sorry. So the lead time on getting the mobile truck, grocery truck that we're talking about is 12 to 16 weeks upon ordering. And that's where we mentioned in that lead time, we are going to hopefully, well, not hopefully, we will still launch this program using their existing farm stand materials.
Okay,
All right,
All
sounds
right.
good. Thank you.
thank you. Anyone else? Okay, so we have a motion, Commissioner Anderson, and supported by Commissioner Baker McCormick. All in favor? Oh, thank you.
Motion carried.
Thank you.
Okay, all right. Okay. So the next, I see some CMOs here, and the next few items that we have is, so, Madam Clerk.
Item 4, requesting commission approval of Amendment 14 to a 2-year contract with 3 one-year options to renew with Black Family Development to account for the fiscal year 2025 second quarter payment adjustment to continue to provide comprehensive treatment plans to juveniles in accordance with requirements of the juvenile justice system.
All right, any questions? Commissioner Anderson?
I'm full of questions.
Okay.
But I did want to ask a question. There's been a lot of publicity in the last month or two about one of the organizations, and I just wonder if it's been resolved. It made the news and was very concerning at Vista Maria, and I'm not sure if it was this location or not. I believe that it is, but there's a lot of questions about kids missing and other things happening that shouldn't be. And I just wondered if you could address that, because I'm concerned about that, very concerned about it.
Sure. So Insight, which part of the contract revision is Insight has merged with Vista Maria. And so the paperwork is done. They are actually here today to answer any questions that you have. Wayne County does not have any young people at Vista Maria currently, or at the time when the news was making its headlines. So we currently don't have any young people there. Licensing is involved. I don't have any updates from licensing as far as where they are. But as far as Vista Maria taking over Insight, that mainly is to provide the administrative and fiscal oversight so that Insight's able to actually do the work. But I do have the executive director here to speak if you'd like to ask some questions.
I would like to hear what changes have been made.
Sure.
Okay,
Executive Director Tawana Reese Rogers.
all right.
Good afternoon.
Good afternoon.
Yeah.
Put your mic on, please.
Yes, it is.
It is,
Mhm.
okay.
Hi, everybody. I'm Tawana Reese. I'm the Executive Director of Inside Youth and Family Connections. As Melissa just mentioned, we have merged with Vista Maria. We will continue to do business as Insight and function how we've always functioned and continue to provide the CMO responsibilities and continue to grow our community-based programming. Vista Maria is our parent organization. We have fully merged. They will continue to work with the state of Michigan to address the challenges that you have heard in the media. And so they're actively working with the state of Michigan to correct and improve the challenges that they've had over the past few months.
Okay. Anyone else? Okay, so we will continue with all the CMOs first. Okay,
Moving to item 5, requesting commission approval of Amendment 14 to a 2-year contract with 3 one-year options to renew with Bridgeway Services.
any questions on this one? Okay,
Item 6, requesting commission approval of Amendment 14 to a 2-year contract with 3 one-year options to renew with CCMO Center for Youth and Families.
any questions on this one? Okay, next item.
Item 7, requesting commission approval of Amendment 14 to a 2-year contract with 3 one-year options to renew with GrowthWorks.
Any questions? All right, and I see that most of them are here here today. But you have no questions. Okay, Commissioner McCormick.
Thank you, Madam Chair. We have, let's see, it says, services at Buckeye Ranch in Ohio. Can you talk to what that looks like?
Sure. So
Residential services.
Buckeye Ranch is a residential facility in Ohio. A couple of our case management organizations have requested that they are able to utilize them because of the challenges with placing young people in the state of Michigan. So due to the timeframes and the wait lists that we still currently have, they have requested to move some kids out of state to be able to comply with a court order for a secure placement without having them languish in our detention center waiting for a bed.
What kind of, well, do we know how many youth would be transferred, if any, as of yet?
I don't believe any have been transferred yet. I do believe there is a request for 1 or 2 that has to go to the state to interstate compact first, and the state has to approve any outside placement before we can support that approval.
Okay, and is this youth that have I guess extenuating circumstances where we can't manage them in any of our facilities? And will their family be involved? Because that seems like a long way if they're, from Wayne County to, for families to visit.
Yes,
Mhm.
absolutely. Excuse me. So those are all questions that the department asks when the CMOs request that, and the CMOs have actually visited them and taken the time. And the parent will be provided the transportation to get to see their young person. Again, it's a last resort. However, in order to bypass a young person sitting in detention for a length, a long stay. Buckeye Ranch is close enough. It's closer than some of our facilities up north. But they do provide comprehensive programming and services. They've been around for a long time. They do a really great job. Of course, it is a last resort and only with the approval of the state who clear, through the interstate compact process.
And I take it that they it's on a ranch, and so they probably have some type of horse therapy and
I have
something
not
like that. I
visited.
don't know.
I don't know. I think some of our CMOs have visited, but I have
Okay.
not visited.
I'm just wondering what type of work they do on the ranch with.
I
the
don't
youth.
think it's a ranch per se, like a farm. I think
Oh,
that's just the
okay.
name of them.
Oh,
but,
okay.
right.
That's what I'm trying to clarify. What?
They're not working in a
Yes.
milking cows, I don't think.
Yeah, but actually there are some programs that use animals.
Equine therapy.
Yes. So I just didn't know if that was it. I was gonna say that's great if we had something like that. I think that might be helpful in some cases.
For sure. And I definitely will share their literature and all of the information that we have and that we've requested from the CMO when they had requested that this be used as a
Yeah,
subcontract.
I just wish it wasn't so far away.
Agreed.
That's the thing. Okay.
Agree.
Thank you.
Thank you.
Thank you. Are there any CMOs that know about this ranch that are here today? No? Okay. All right. We'll get it figured out. All right. Any other questions? All right, hearing none, there's a motion by, oh, I'm sorry. There's one more.
Moving
Okay,
back to
sorry.
item 8 on the addenda, requesting commission approval of Amendment 14 to a 2-year contract with 3 one-year options to renew with Vista Maria, DBA Inside Youth and Family Connections.
Okay. Any questions on this one? Go ahead, Commissioner McCormick.
We don't have anyone from Vista Maria, other than, I know you just had Insight
We don't.
person. Okay. Okay, that's, okay.
Okay. So anyone from
We have a
Spectrum?
motion by Commissioner Baker McCormick and a support by Commissioner Anderson for items 4 through 8.
All in favor? No, thank you.
Motion carried.
All right, thank you. Okay. And I see there's a number of CMOs here. Thank you for being here.
Item 9, requesting commission approval of Amendment 2 to a 1-year grant agreement with the Michigan Department of Health and Human Services for the fiscal year 2025 to 26 Local Health Department Comprehensive Agreement used to support various public health programs.
Good afternoon,
Good
Commission.
afternoon.
Dr. Brianna Osorio, Director of Public Health Division.
And Dr. Shell, Chief Medical Officer and Division Director for Clinical Care Services.
So this is just an amendment to our CPBC agreement with the state to provide funding for various of our programs. So this was just a modification for our WIC program, as well as our kindergarten oral health assessment, which is a new program that is getting ready to start as well. So we had to decertify funding for a part of our WIC program, just a reduced caseload that we have in WIC at the moment. So that is the reason for our reduction in the WIC program.
So that you don't have as many?
Yeah, we have a lower enrollment
Okay.
caseload. So the state does an evaluation pretty much to look at what are our cases over the past 2 years. And so they have they have reduced our enrollment caseload based upon what our cases have been.
Okay.
Yes.
Commissioner Kleen?
Thank you very much, Madam Chair. So, a lot of money in WIC. Thought I had it. That's a lot of money in WIC.
Yes.
600,000.
Yes.
How many people does that represent?
So that was a reduction of approximately 1,300 clients. So we have been,
How does somebody sign up for WIC?
they sign up through, I've got to think of what the name of the website is, but essentially it's through the state. They offer the My Bridges, they offer WIC, and it's also through referrals as well from their providers. And so once you're eligible for WIC services, then you're referred to one of our clinics, and then we provide those services for mothers, mother, infants, and children.
We promote around Wayne County, that website, and say signed up. See, I can't imagine in today's environment that people are less needy.
Well, we have several cases. So we're around a little bit around 16,000 and above. So we have a capacity of about 18,000 now. But just the ability to, I will say after 2020, essentially, we were no longer able to do virtual clinic visits. And essentially, that means that people have to come in for those visits. So just in the reduction of the pattern and trends that we have seen, it has reduced over the past few years.
So the state pretty much controls the front door to this?
Yes.
To get in?
Yes.
And we can't, through all of our, including the CMOs and all of the stuff that we do in the community, we can't get the message out as Wayne County to say, hey, make sure, here's the website, make sure you go on and sign up. We can't do that?
We usually, the state pretty much offers and does the advertisement for a lot of those services. We do, of course, always offer it at our different clinics as well to showcase our WIC clinic. And then on top of that, we are just making sure that we are also stabilizing our own staffing. We did not have a WIC coordinator for a while, so essentially we're just working also on our ability to also increase our capacity. And then we have subcontractors that work with us to also provide those services. We work with both Access and ACC that also help us provide that.
So we've been a little short on people power to make WIC work on a day-to-day basis in Wayne County?
That has been the case for a while, but we have been working on that as well with our staffing. Yeah.
Because this is real sad, and I can't imagine in short order we couldn't find 1,300 families that go, yeah, you better believe. I got a dozen on the block, on my block going down, a few. And then the other thing is the kids' oral health. What, it sounded like you were saying we have a program, but it's not up and running yet.
Yeah, this is a new program, the state, am I on? Yeah, there we go. This is a new program that the state is rolling out now.
They're already cutting funds to us for it.
It's connected to a ruling at the state level that has now implemented a requirement for kindergartners to have an oral health screening for entry. It does not preclude them from entering school, but it's part of that health form that all kindergartners complete on school entry. And so this is a new program. I believe that legislation passed maybe a couple years ago, and they're rolling it out through the local health departments to provide an access point, especially for our families without access to dental providers. So it's a brand new program with new allocations and funding that we are working to build out with this funding.
Your name and title, doctor?
Sure. Dr. Sheth, Chief Medical Officer, HHVS.
Yeah,
Thank you.
Yeah, try to find a dentist around town.
Yeah.
Good luck. This is only for kids going into kindergarten?
Yes, so this program is focused on the younger kids, so screening at an earlier age, earlier detection, and the big, it's a screen. We are responsible for the screening portion, but part of it is any child that is identified with any abnormalities or cavities or risk that we are helping them navigate to dental providers, and I think that's the biggest barrier is actually getting to a dental provider, and so we're trying to really focus on that early
Yeah.
early age.
So what we would do is be a referral service then.
Yes, and
Here's-
like
here's Dennis
engagement.
In your
yeah.
neighborhood, that kind
Yeah,
of.
engagement and navigation coordination. But the way that we are planning to implement is through our federally qualified health centers who already have a partnership with U of D dental program. And so they are a dental provider through our Hamtramck and our Wayne location. And so we are really implementing this in partnership. So, soon after, what will come before you is an agreement with our FQHC to partner on implementation of this program and really leverage that existing relationship with U of D Dental Mercy Program. So we can kind of close the loop on the whole thing with actually getting them to a dental provider as well in a medical home.
Great concern about oral health. So is the state ready to launch this? We just have to develop relationships with our partners locally in order to get it rolling?
Yeah, so this is our first allocation for this program. So we are,
Your first deduction.
no, so that's a
Oh, no,
separate.
the
So
reduction is
So
just,
in this amendment, so this is the second amendment for the comprehensive
Yeah.
CPBC agreement. In this amendment, it includes one, the reduction in the WIC program for funds, and then a new allocation for the kindergarten oral health.
Okay, so we're gonna be able,
Exactly,
so we're gonna be able to
yeah.
correct, yeah.
hopefully get this.
We're working hard to get it, it's June and we got the amendment, the funds in the amendment, but we're really working hard to try to get it up,
Yeah, it's just-
operationalizing on the funds as
Because the
quick as possible.
situation around town is just horrible. And I can remember, it's a few years back now, but talking to medical personnel at the juvenile detention facility, and I said, you wouldn't believe 16-year-olds that show up over here. First time a dentist has looked in their mouth in their life. And you would not believe what we see in there. So this is important, but a small part
Exactly.
of that larger
Mhm.
issue that we have out there. Okay,
All right,
thank you.
Ken.
Thank you, Madam Chair.
Okay, would you like to add something? You came to the table. Give your name.
Good afternoon. My name is Keneal Johnson, Interim Director for the Department of Health, Human and Veteran Services. And just wanted to comment on the WIC funding reduction.
Okay.
And just assure you that we are looking to re-strategize our approach to how we serve the community with WIC, specifically with staffing. And that has been a primary challenge for us over the last couple of years. And so we are working internally to increase our recruitment efforts. And we are optimistic that we will be able to get to the appropriate staffing. And so we can regain the caseload that we lost that caused the reduction in funding next fiscal year. So just wanted to share that with you all.
Thank you. Commissioner McCormick.
Thank you, Madam Chair. So, the WIC, that is very concerning. You said something about that they needed to come in rather than, I guess, is that to qualify or
Yeah.
ongoing once they qualify? How does that work?
So WIC is very specific on the type of services that we provide. And then you also have to have like an in-person meeting and visit. So we just also updated our policy. So we do have some virtual visits, but essentially the nature of the actual program itself, you do have to come in person. So we were able to do a lot more things virtually over 2020, even with the reduction of staff. We were still able to maintain that because virtual clinics make it a lot easier for you to still see more. So since coming back in person, we are just working hard and making sure that we're improving our caseload numbers with the staffing model that we have. And we're just continuously working on expanding even our brick and mortar locations to be able to provide even more services. And the biggest thing is we're just, really working on our recruitment strategy. We've done a lot of this, of course, during collaborative bargaining and also with our registered dietitians and a lot of their, what they actually need to be able to become a dietitian. And this is just overall in the state, there's just been a really tough competitive thing because now we're competing with private practice. So really what we're able to offer, and because this is a very specialized program, it's a little harder to get folks in, but we're still working through and making the best of it. And we've made definitely some increases already over the past year. The state is just working along with us to make sure that they are that we're meeting our standards for this actual program. So the part of this reduction is just to kind of right size of where we've been at for the past few years. So the reduction kind of has been a little bit the discussion of this is what's been expected. But a lot of this is like they're trying to also help us meet our standards and be in compliance because we have to see our mothers and children within 10 days, 20 days. So we have specific restrictions. So we got to make sure that we are doing our best to serve them with the highest quality of care and when they need to come in. So again, this is something we can continuously work on and earn back. Of course, and so we will continue to make our efforts to make sure that we're doing everything that we can to increase our caseload.
And when you talk about brick and mortar, where do they currently have to come? You said you have to see them in person. Where is that? Is that one location, two? How many?
So we have our Wayne location, our Wayne Clinic at the Health Administration Building. We have our Taylor location, and we have Garden City, Sumter, and Hamtramck. And so we are located with Hamtramck in the same FQHC.
Okay. And do we know which of these locations, where these numbers came from, where the drop came, where the 1,300? Was it from any certain area in particular?
No specific, not a specific area. And a lot of the times because you have to meet, you have to see high risk patients within 10 days and those with children within 20 days. A lot of the times they end up getting referred or going to other WIC services to also get that, get their needs met within that time.
Okay, so they can go to other programs that have WIC
Yes.
and not necessarily come, to Wayne County.
Not specifically Wayne County WIC programs.
Okay,
specifically.
great. So that means that 1,300
Are still being provided the
provided
services.
through
Yeah.
someone else, but maybe
Yeah.
not Wayne County.
Yes.
Okay. Well, that's good to know. Okay.
Yes.
All right.
Thank you.
Commissioner Marecki?
Okay, so I was going to ask the same question, but different ways. So my first impression was that when it was a requirement for people to come in face to face, all these families dropped out because before it was on Zoom.
Yes.
But is it it's a combination?
It's a little bit of a
Okay.
combination where a lot of them were, like, it was, some folks were having a hard time coming back in person. And then there was that combination of also us having the ability to see them. So they were also being referred to other locations while we also refer them to our subcontractors. So again, they're still getting provided the services still, even if it's not through just our specific program.
Okay, so did the state require that they come in?
This is,
One-to-one?
this is a actual like regulation that we have to make sure that we see our clients. It's all for nutritional purposes as well. So there's certain
That makes
things
me
that you
feel better.
can't.
I thought they just dropped out because they weren't on Zoom anymore.
No,
But it's
no,
okay.
no.
But it's a combination of stuff.
yeah,
All right,
yeah.
thank you.
No problem.
Anyone else? All right, thank you all very much. Next item.
We need a motion and a second for item 9.
Okay, we have, it's been moved by Commissioner McCormick. Second by Glenn. All right. All in favor? Let's vote. All right.
Back offline.
Thank you.
Are you a yes vote?
Yes.
Motion carried.
All right. Thank you. Next item.
Moving back to the agenda,
Okay.
F, such other matters as may be properly submitted before the committee.
I don't know of any.
G, public comments.
Anyone online? Is there anyone online that wishes to make a comment? All right. Anyone in the audience wish to make a comment? Is there anyone in the audience wishes to make a comment? All right, thank you. Next item.
Adjournment.
It's been moved and supported. We are adjourned.